Hi, Valder.
Hi.
Jenna, hello. Dr. Amit Mahipal. Thank you so much for being my guest on the Valder BB show today. I really appreciate it. Thanks for being here.
Thanks for having us.
I'm going to start with Dr. Amit. Dr. Amit, I'd like you to just give us a basic understanding of what colorectal cancer is and then tell us who it affects.
Sure. So, colorectal cancer is a type of cancer that starts either in the colon or rectum. But many times it can spread to other parts of the body, making it metastatic colorectal cancer or the stage 4 colorectal cancer. It's the third most common cancer worldwide and is the second leading cause of cancer related death. So, it's very common. And what we have found recently is there has been increase in incidence of metastatic colorectal cancer in young people as well as minority patients.
If there has been an increase, is there a reason why there's an increase? Because you said it's stage 4. It's not being found before stage 4?
Yeah, so we do have screening programs for colorectal or colon cancer, but typically the colonoscopy right now the guidelines which were 50 years of age now they have been decreased to 45 years of age. So at beginning of 45 years of age, as long as you don't have other history, you can start getting colonoscopy. But we do not have screening programs before that for patients who are otherwise standard risk. And we don't know the cause of why there has been such an increased incidence in younger patients. We think it's some environmental causes, but there are a lot of studies looking into that and trying to figure out why the number of cancer is increasing in young patients.
I'm going to speak to Jenna in a moment, but I want to ask you, I think people get screened every 10 years for colorectal cancer. I'm not sure if that's correct, but why such a long time before they're even screened?
Sure. So again, we're talking about patients who are standard risk who don't have very, very high risk of like other diseases. And typically we tend to do every 10 years because what happens in the colon or rectum, typically it develops a polyp and that turns into a cancer and that process takes years. So that's why we have guidelines to do it every 10 years.
Okay, Jenna, thank you so much for being here. Can you tell us about your experience?
Yes, absolutely. So I was between 7 and 8 months pregnant with my son when the symptoms first appeared, and the doctors kind of masked it to say it was just pregnancy symptoms. And a year later, I was still having the symptoms, and then I was diagnosed in 2017 at the age of 31 with stage 4 metastatic colon cancer. And it was devastating, and it took an emotional and physical toll on me. It took an emotional toll on my family and my friends. And I just really focused on my son in that moment to make sure that the goals that I set out for myself from then on were focused on seeing him grow up. And that's what I did.
Thank you so much. Doctor, let me ask you, there was a recent survey on metastatic colorectal cancer patients. Tell me the takeaways, and did that include what Jenna is saying?
Yeah, absolutely. So this was a survey which was sent to over 300 patients with metastatic colorectal cancer. This survey was commissioned by Takeda, on whose behalf we are here today. And what they found was that at the time of diagnosis, majority of the patients feel overwhelmed. They felt alone, and they wish that they had more power in treatment decision making. So what we learned from that survey is that we need to have more resources for make it easy for patients to navigate the complex healthcare system and learn how to deal with daily living while living with colorectal cancer.
Jenna said they found her cancer. Well, they talked. They I guess acknowledged her cancer after her child was born. Had the cancer, as you know how it grows, has it been growing all that time?
Yeah, so in that particular case, yes, I mean someone is having symptoms needs to be investigated right away, otherwise cancer can potentially grow and also can potentially spread to other organs if not found early.
Jenna, I'd like to ask you, what were some of your symptoms, and give me your findings on this survey. How does that intersect with your cancer?
So my symptoms were very severe abdominal pains. rectal bleeding, I had nausea, vomiting, and rapid weight loss. But again, I had just had a child, so the rapid weight loss I thought was a good thing. But from the survey, I really resonated with a lot of the patients who said they were feeling overwhelmed with the information that they were receiving and felt a sense of isolation and that they didn't have someone to talk to. But I found that reaching out to advocacy groups and getting knowledge on resources gave me a sense of power to lead the conversations with my doctors and not just kind of be a passive patient, but an active patient to then make sure that I had the quality of life that I was looking for.
As you gain this knowledge, and does it make you feel like you can survive this? What does knowledge do for you in this particular instance?
Knowledge gives me hope. It gives me a lot of hope, and I don't go a day without knowing that I'll be able to survive this. As long as I keep fighting and I keep my positive attitude and doing what I do every day, just trying to shine a light on this world, I feel like I can do anything. So, yes.
Well, I want to thank you for being here to share your story. You make such a difference in this world. Thank you very much. Doctor, I'd love to ask you to wrap up with, what do you want people to know about colorectal cancer, especially when they're younger?
Yeah, so one thing to mention, anytime someone has those symptoms that we just talk about, like abdominal pain, rectal pain, bleeding, weight loss, as Jenna mentioned, any of those symptoms, go to your doctor right away. Also, if you want to learn a little bit more about colorectal cancer, or also learn about this survey, you can go to this website called understandingmcrc.com. So again, understandingmcrc.com, and has all that information.
Dr. Ahmed and Jenna, I want to thank you so much for being here on the Valder Beebe Show and talking about a very important subject.
Hi, I'm Valder Beebe, host of the Valder Beebe Show.
Thanks for
We
having
have
us,
over
and have a great
1,000
day.
videos on ValderBeebeShow.com and YouTube.com/ValderBeebe Show. We upload new videos daily. Our site is a modern baby boomer platform with news and information important to boomers. Subscribe to youtube.com/ValderBeebe Show and stay connected as I interview the world's most fascinating people.